Right now, touch your big toe. Both of them. Go on, do it. Now compare. Does one foot feel even slightly cooler than the other? Most people have never done this in their entire life. And in the next 10 minutes, you might find out why that tiny, almost meaningless feeling could be one of the quietest signals your body has been sending you for years. Somewhere in America right now, a man is sitting on his couch. His legs feel a little tired. He blames it on age, on standing too long at the store, on an old injury from decades ago. He rubs his calf and goes back to his show. What he doesn't know is that his body may have been trying to get his attention for a long time. Not loudly, not with a heart attack or a stroke, something quieter, something that hides in plain sight. Some vascular specialists call it the silent thief, though not because it's dramatic, but because of how easily it disappears into everyday life. And by the end of this video, you may look at your own feet differently tonight. If stories like this matter to you, the kind that uncover the small signals your body gives before something bigger happens, hit subscribe now, because what we're about to walk through could change how you think about something as ordinary as a cold foot. Let's go back to that toe test for a second, because it's actually rooted in something real. Your feet are the farthest point from your heart. Every drop of blood that reaches your toes has to travel through your chest, your hips, your thighs, your calves, a long journey that depends on a network of arteries staying open and clear. When those arteries slowly narrow over the years, something called peripheral artery disease, blood flow to the feet can drop just slightly. And one of the first places that shows up is skin temperature. A foot that's getting a little less blood can feel a few degrees cooler than the other one. Not painful, not dramatic, just different. That's the whole idea behind the toe test. It's not a diagnosis, it's an observation. One potential early sign among several that some vascular specialists pay attention to. If your toe felt the same on both feet, that's a good thing. But if you noticed a difference, even a small one, keep that in mind because we're going to come back to it. Here's something that might surprise you. An estimated 8.5 million Americans over 40 have this condition, and researchers believe more than half don't know it. Not because it's rare, because it's quiet. So today, instead of the usual textbook explanation, we're going to walk through the small, strange, easy to explain away things your body might be doing right now, and what they could potentially mean. Let's start with the legs themselves. For some people, the first sign isn't pain, it's just tiredness. One leg gets tired faster than the other while walking through the mall, mowing the lawn, or climbing the stairs to bed. Not agony, just heaviness, like that leg is working harder than the other one. Sit down for a few minutes and it fades, so most people forget about it. Until next time. Doctors have a name for this pattern, claudication. But here's what often gets missed. It doesn't have to be severe to matter. Sometimes it's a dull ache, sometimes a tight cramp, like a rubber band squeezing the calf. Sometimes just a feeling of running out of fuel halfway through something that used to be easy. This pattern, discomfort that shows up with activity and eases with rest, is considered by many vascular specialists to be one of the more recognizable early signals of reduced blood flow in the legs. But because it feels so much like ordinary aging or being out of shape, most people never mention it to a doctor. They just slow down. They take more breaks. Life quietly rearranges itself around it without anyone noticing the rearranging. Now let's go back to that toe. Try this tonight, after a warm shower, when your whole body should feel evenly warm. Place the back of your hand against the top of one foot, then the other. Compare them. A noticeable difference in temperature between your 2 feet is something some specialists consider worth paying attention to, because it can reflect a difference in blood flow reaching the skin. It's subtle. It's the kind of thing that's almost impossible to describe to a doctor. My foot feels a little colder. So most people never bring it up at all. But your body isn't being dramatic. It's just speaking quietly. There are a couple of other quiet signals worth knowing, and we'll move through these quickly because individually they're small, but together they start to form a pattern. Toenails that seem to grow more slowly than they used to, or that have become thicker or more brittle. Hair on the lower legs that's thinned out or disappeared, sometimes more on one leg than the other. Both of these depend on a steady supply of blood reaching the skin and the tiny vessels feeding the nail bed and hair follicles. So when circulation drops even slightly, these are sometimes among the first places it shows. None of these prove anything on their own. Genetics, age, and a dozen harmless things can explain any one of them. But noticing more than one, especially alongside that toe temperature difference, is the kind of pattern some specialists say is worth a conversation. Here's where things get a little more unsettling, though. Some people with reduced blood flow to the legs notice a strange kind of discomfort at night, a burning or aching in the feet that seems to get worse the moment they lie flat to sleep. And many instinctively find relief by hanging a foot off the side of the bed or sitting up and letting the leg dangle. Why would that help? Lying flat removes the natural assistance gravity gives to blood heading toward the feet. If the arteries are already a little restricted, removing that help can make the shortage more noticeable. Letting the leg hang down uses gravity to pull a bit more blood toward the foot, easing the discomfort. If you've ever found yourself unconsciously sleeping with one foot hanging off the mattress and always assumed it was just a habit, this might be the first time you've heard there could be a reason behind it. A reason your body figured out long before your conscious mind noticed the pattern. But here's the part that turns all of this from interesting into something genuinely important. The arteries in your legs aren't separate from the arteries in your heart and brain. They're part of the same highway system. The same slow process that narrows arteries in the legs is, in many cases, happening in the arteries feeding the heart and brain too. Research has consistently found a strong link between reduced blood flow in the legs and a higher likelihood of similar changes in the coronary arteries, the ones that supply the heart itself. In other words, your legs and feet might not just be telling a story about your legs and feet. They might be giving you an early glimpse into something much bigger, in places you can't see and can't feel. Think about what that means. A slightly cooler toe, a leg that gets tired a little sooner, a toenail that hasn't grown much lately. These aren't just inconveniences of getting older. For some people, they might be the surface of something much deeper. And here's something most people never think about, what some doctors call adapted normal. This happens when someone's activity level decreases so gradually over so many years that they stop noticing the limitation entirely. They take the elevator instead of the stairs, not as a conscious choice, but because somewhere along the way, the stairs started feeling like too much, and they quietly stopped trying. They park closer to the store. They take more breaks during yard work. And if you ask them, they'd say they're just taking it easier because they're older, not that they're avoiding discomfort their body has been generating for years. This is why family members sometimes notice changes before the person does. A daughter who notices her father stopped his evening walk. A husband who notices his wife needs more rest breaks in the garden than she used to. Small shifts that viewed alone look like nothing, but together tell a different story. And here's something specific worth knowing, especially for the women watching. For a long time, this condition was thought of as mostly a man's issue. But research over the past 2 decades suggests women are affected just as often, and in some cases, their symptoms show up in less typical ways. Instead of classic leg pain during activity, some women report general leg weakness, unusual fatigue during normal daily tasks, or discomfort that doesn't match the textbook description at all. That mismatch is one reason some specialists believe the condition has historically been underdiagnosed in women. If you're a woman noticing any of these signs, even if they don't feel classic, they're still worth mentioning. So what do you actually do with all of this? None of these signs, the toe, the toenails, the hair, the night discomfort, the tired leg, prove anything on their own. Many have simple, harmless explanations. That's exactly why they're so easy to dismiss one at a time. But if you notice 2 or more of these, especially that toe temperature difference, along with leg fatigue that eases with rest, or changes in your toenails or leg hair, or foot discomfort at night that improves when you sit up, that combination is the kind of pattern many vascular specialists say is worth bringing to your doctor. Not out of panic, out of awareness. There's a simple, painless test your doctor can do called an ankle brachial index. It compares blood pressure at your ankle to blood pressure in your arm, takes just a few minutes, and gives real information about how well blood is reaching your legs. Timing matters here. Many specialists agree that peripheral artery disease, caught early, can often be managed through lifestyle changes, medication, or both. Left unnoticed for years, the options can become more limited. And this brings us to something almost philosophical. We live in a culture obsessed with the dramatic, the sudden collapse, the 911 call, the hospital room with machines beeping. These are the moments we're trained to watch for. But most of the body's important messages don't arrive as alarms. They arrive as whispers. A slightly cooler toe, a toenail that grows a little slower, a leg that tires a little sooner than it used to. Quiet, patient, waiting. Maybe that's the real takeaway hiding in all of this. We spend so much energy listening for the loud signals that we forget our bodies have often been talking to us in a much quieter voice, for months, sometimes years. Tonight, when you take off your shoes, do that toe test again. Compare your feet, the temperature, the color, the nails, the hair. You might find nothing unusual at all, and that's a good thing. But if you do notice something, even something small, don't brush it off the way so many people do. Mention it to your doctor, not because it's definitely serious, but because catching the whisper early is so much better than waiting for the shout. If this opened your eyes to something you'd never thought about, let us know in the comments. Did your toe test feel the same on both sides, or did you notice a difference? Share this with someone who might need to hear it, because sometimes the people closest to us are the last to notice what's right in front of them. And if you want more videos like this, the kind that look at the small signals the body gives long before anything dramatic happens, make sure you're subscribed so you don't miss what we uncover next. Because the truth is, your body has been talking to you this whole time. The only question is whether you've been listening.